I believe that public policy should improve people's lives, not make them harder. After a meaningful, yet often frustrating career advocating for public policies to fight hunger and poverty in America, learning that I have brain cancer fundamentally changed my outlook. An expert in food and nutrition assistance programs, I've spent years using data analysis and advocacy skills to fight cuts to vital federal nutrition assistance programs like SNAP or food stamps, WIC, and school meals, and to make it easier for individuals and families living in economic precarity to put food on the table. I began my career with optimism, but developed a growing sense that we were not making progress. We were just putting Band-Aids on the problems instead of fixing them. Last fall, after months of dizzy spells, olfactory hallucinations, and debilitating headaches, a brain MRI revealed that I have brain cancer. I had surgery to remove as much of the tumors as possible and underwent weeks of radiation, chemotherapy, and other treatments to disrupt tumor growth. Glioblastoma is incurable, but it is treatable for a time. The doctors throw everything they can at the tumors to disrupt growth and spread, but eventually they will grow back. They explained that the average life expectancy is 1 to 3 years, but some patients survive 10 to 15 years. They proposed various treatments that could extend my life by 4, 6, or 12 months, but didn't explain a treatment pathway that could make it possible to survive 10 to 15 years, even if unlikely. When asked about this, they explained that there is no specific pathway. It's basically just luck. Even with the same treatments, some patients will survive a decade or longer, and some will die in 2 or 3 years. Medical science doesn't yet know why. Early in my career, in 2001, there were 33.6 million people living in households struggling with food insecurity, meaning they didn't always know where their next meal was coming from. After nearly a quarter century of advocating for better farm bills and fighting off draconian cuts to SNAP and WIC, how much progress have we made in reducing food insecurity in America? In 2024, the most recent year for which we have data, there were 47.9 million people living in food insecure households. That's more than 14 million more people than when I began my career. I believe we can and must do better. After my cancer diagnosis, I was forced to reevaluate my career goals and priorities. I'd previously hoped to lead data research or advocacy for a national organization focused on hunger and poverty, but that was no longer a viable option as I was struggling with dizzy spells, seizures, and time-consuming cancer treatments. I had to decide what I would do with the time I have left, whether it's 12 years or 12 months. I decided that I would stand up for people living in poverty, to tell the truth about poverty in America, and to do what I could to help find a viable path forward. Speaking of pathways, I realized that just as oncologists haven't yet developed effective pathways to long-term survival with glioblastoma, we in the policy and advocacy community haven't yet created or communicated practical pathways out of poverty. In fact, many public policy decisions actively cut off promising pathways that do exist. I realized that we were never going to get there. We were never going to get to the day where we could say we have ended hunger and its root cause, poverty, unless we change. We had to reset and rethink the way we approach hunger, poverty, and homelessness, and the way we see and treat those that they afflict. Poverty is a function of income compared to the ever-rising cost, right, of basic needs, along with access to resources and power imbalances. The prevailing narrative of poverty demonizes people living in poverty But in reality, poverty is a math problem that doesn't add up. As long as we allow employers to pay wages that leave workers with annual incomes below the federal poverty guidelines, by definition, we will never end poverty. As long as we use a flawed measure of who struggles to meet basic needs and rely on that flawed measurement to divide people into those who deserve assistance and those who do not, we will continue to be a country where, just a few years ago, 15 million people lived in households that struggle with outright hunger. That means they actually had to skip meals, or parents had to cut their own portions so their children could eat something. Negative attitudes towards people living in poverty are commonplace. A couple examples. SNAP and WIC participants often report being shamed in the grocery store checkout aisle when using their benefits to pay for their food. They hear comments from customers behind them like, "I paid for that food, you know. You're welcome." Children are not spared this kind of shaming. When parents accumulate school meals debt because they had a cash flow issue or simply forgot to top up their child's school meals balance, staff will put stickers on a child's shirt or backpack that read, "I owe school meals money." Our culture's slanderous, victim-blaming attitudes towards people living in poverty are reflected in our social safety net policies. Two examples. Asset limits. To make sure the wrong people aren't getting benefits, SNAP, TANF cash assistance, and Medicaid require participants to meet an asset test in order to qualify for benefits. Liquid assets, like checking and savings accounts, the value of many cars, and even the value of burial plots you own, must total in value less than the federal asset limit, currently $3,000 or $4,000 depending on household composition. So if you have a car, which will make it easier to pursue work opportunities and become self-sufficient or to pursue higher education, it counts against you. Work requirements. SNAP, TANF, and now even Medicaid require participants to meet certain work requirements to keep getting benefits. SNAP requires participants to work 20 hours per week or register for work and job search activities. One kind of activity that does not count towards these work requirements: coursework in pursuit of higher education. Building savings and pursuing higher education are two of the most powerful pathways out of poverty. Yet through policy design choices, we cut off these promising pathways. In order to fight poverty effectively, we first have to understand what causes it. Here's some of the most common pathways into poverty. Medical crises, I know something about that. Financial setbacks, divorce, domestic violence or abuse, a death or disability of a parent leading to loss of income, loss of health insurance, or low wages. Or some people fall into poverty simply through mistakes or failure. We all fall on our face sometimes. What is the proper price for making mistakes? Poverty, homelessness, eviction, not being able to feed your children? Or consider, what if we responded to failure with care and a robust social safety net? It is imperative for our collective survival that we develop a new social contract. Poverty isn't just a them problem. It could be a you and me problem any day. I have brain cancer. I could have gone from them to me so quick. Brain cancer is not cheap to treat. I'm not able to work. My wife is not able to work because she's taking care of me, our kids, and her aging parents. If we didn't have good health insurance through my employer, we'd already be in medical bankruptcy. The bills are staggering. There's no escaping the fact that the solution to hunger and poverty must involve getting people more money and lowering the cost of living through universal benefits. a living wage, or at least a significantly higher federal minimum wage, which has been stuck at $7.25 an hour since 2009, would be a good start. Other promising policy options include universal basic income, universal health care, reforming and simplifying SNAP, and increasing benefits. We have to take a new approach, or the poor really will always be with us. But that's a choice on our part. The thing is, we actually have the tools to end poverty and hunger now. We could do it today, tomorrow. The first step is wanting to. My medical care team told me, there's nothing you did to cause these brain tumors. There's nothing you could have done to prevent them. They are bad luck tumors. While many people fall into poverty through bad luck, there are policy solutions that don't just rely on luck, like some of the ones I just mentioned. Universal benefits and increasing people's earnings and income. We have the opportunity to end poverty and hunger in America. Through so doing, we could transform the American economy, rebuild and revitalize the middle class, maximize the potential of America's children, and the millions of Americans with incredible talent, but long odds of making ends meet so they can pursue their dreams. This isn't just a pipe dream. A few years ago, Brazil was removed from the international list of countries with food insecurity after they lifted 5 million people out of food insecurity in just a handful of years. We can do that here too. To the advocacy community, I see you. I see your passion, your dedication, your exhaustion and frustration. I know it's hard. You wake up every day making the same arguments against work requirements, asset limits, and more. But please, keep going. We need you in the fight, and I'll be in it right beside you. To the philanthropy community, advocates can't do their vital work without the fearless backing of philanthropy. To everyone else, through my cancer journey, I have been astounded by the community of caring friends, family, neighbors, and even complete strangers who have formed around me to do everything they can to help me fight my cancer. Driving me to radiation sessions or other appointments, bringing my family meals, researching new therapies, explaining clinical trials to me so I could weigh the benefits against the very scary sounding risks. And then there's the medical community, the doctors, the nurses, the radiation techs, the occupational physical therapists, even roving musicians at the hospital, lightening the mood for patients and families when they're going through the darkest stage of their lives. My example is the path forward. This is the path to the beloved community. We can do it because we're already doing it. If we all work together, if we all play a part, we will build a world where no child goes to bed hungry, where no parent has to choose between eating or paying their electricity bill so they have heat and a working stove. A world where everyone can meet their basic needs with confidence and dignity. And then there's in the fight against hunger and poverty, just as in my fight against cancer, there is a role for everyone. Whoever you are, there is a role for you. And it matters. We need everyone now. Thank you.